East, you find out that the food that is consumed over there differs from what you see that are eaten in the eastern part. Also, there's also difference from what you see in the West. And if you go to the South, you see something different. So every ethnic group have their own ethnic food. What you don't like eating, another person might like. So we must respect that cultural diversity, as well as health inequities that people go through, inaccessibility and other things that are challenges that people go through. Then misinformation and industrial influence. If you go to social media today, is awash with misinformation. And also we have a high level of industrial influence in terms of marketing, influencing and inducing health workers to promote their products, whether it has produced an evidence-based solutions or not. So ethical practice is the foundation of responsible and professional nutrition care. And one will ask, what is ethical decision making? It's a systematic process of evaluating values, principles, consequences. So values, principles, and consequences. What are the consequences of each action, each value, and whatever? So it involves choosing action that respect clients, promote well-being, and uphold professional standards. Why is it important? It protects clients' rights and dignity. It ensures evidence-based and unbiased care. It builds trust between dietitian and the clients, and it supports accountability and professionalism. So I want you to type in the Zoom chat. I want you to participate. Who is a dietitian nutritionist? Who is a dietitian nutritionist? Just go ahead in the chat. Feel free to type. It will also be nice if you type your name to identify where you are joining this from and your institution. That would be nice. I'm waiting for your response. Who is a dietitian nutritionist? You don't need to give me a dictionary definition. Just go ahead, type. You need to participate. I want to be sure that you have not left me and you're sleeping. I'm still waiting for people to type. Thank you, Dr. Chechi. A board certified food and nutrition expert with degree in nutrition and dietetics. A dietitian nutrition is someone who uses scientific knowledge of nutrition to help people eat well, stay healthy, and treat medical conditions through proper diets. A nutrition expert who uses nutrition principles to treat health conditions. Dietitian nutritionist is a nutrition professional that uses principles of nutrition in the management of disease conditions, known as JUTs. Thank you. Ijoma is a trained healthcare professional who promotes health and manages diseases. Amuche, a dietitian nutritionist, is a registered health professional that has the rights, training, and qualification to solve nutrition-related problems. Thank you very much for contributing. So we see, based on the definition of ICDA by law in September 2016, a dietitian nutritionist is a professional who applies the science of food and nutrition to promote health, prevent and treat diseases, to optimize the health of individuals, groups, communities, and populations. All that we wrote on the comment are all in line with what is here. But one thing I highlighted there is it's a professional. So there must be a professional practice, professional ethics that the dietitian must So, but a dietitian must have a minimum level of education. Is bachelor's degree and a period of supervised professional practice of at least 500 hours and meet the international competence standard for dietitian nutritionist. Now, the international competence standard for dietitian nutritionist, I have shared the document with you. You'll have it in your email because we are going to make use of it in the course of this webinar. This defines those minimum competencies that any dietetic practitioner should demonstrate at the point of entry to the profession. And we act as a framework for their continued professional development throughout their professional life. So telling us that it's not the time you enter and you are qualified as a dietitian, you stop learning. Learning is a continuous process and something that you keep doing on regular basis. So when we talk about code of ethics, a code of ethics is a written set of principles and rules with the purpose of, number one, helping professionals conduct their action in accordance with primary values, principles, and ethical standards, as assuring the public that members of regulated profession are acting in a socially and professionally accepted manner, assisting individuals to govern their decision-making, and helping professionals practice honestly and with integrity, guiding against malicious or self-serving practices and actions. So these are ICDA and EFAD. EFAD is European Federation of Association of Dietetics. So definition of code of ethics. So we see here that code of ethics today, do we have any in Nigeria? We have not really had any principle code of ethics that we have developed as dietitians in Nigeria, because it's a challenge. While we have ICDA code of ethics, Dan is expected to develop one for local context, because there are things that are peculiar to us as a nation and as dietitians in Nigeria. So it's important, it's high time we develop one that integrates local context. So there are principles of core ethical principles. Number one is autonomy, respecting client choices. Beneficence, acting in the client's best interest, not in your interest, but the best interest of the client. And non-malfeasance, you are making sure that you do no harm to the clients, and then you are fair and equitable. We are going to look at it one after the other now. Number one is autonomy in practice. You are supporting informed decision-making, respecting cultural, religious, and personal beliefs. Example, a client refuses a recommended diet due to cultural reasons. And you don't force the client to say, oh, you must eat this, you must do this. If you don't do this, this will happen. You don't threaten the clients to. Beneficence, you are promoting health and well-being, providing evidence-based recommendations, and avoiding misinformation or fad diets. Non-malfeasance, you're avoiding harm, whether it's nutritional deficiency or self-advice. You are recognizing limit of your competence. You don't practice beyond what you know or beyond your training. And you are referring when necessary. And the fourth one is justice, ensuring equitable access to nutrition care. Your family member just came to the clinic, and because you are the dietitian, you want your family member to jump the queue to see you before the other people that have been there. You are not just, because others are also waiting. They're on the queue. So addressing social determinants of health, including food insecurity, looking at those that live in resource-constrained area that don't have money, poor people, and also avoiding discrimination. It's not from my religion, or it's not from my tribe, or does not speak my language. Those should not be a barrier in providing professional care to a client. So key guiding principles and ethical standard is respect for autonomy. individual care, ensuring that informed consent, respecting the client's right to choose, and tailoring care to individual values and goals. Doing good, taking protective steps to benefit clients, promoting health and well-being, and acting with compassion. Not harming anybody, minimizing risk, practicing within the scope of competence, and avoiding harm through incompetence or negligence. Fairness and justice, treating all individuals equitably, advocating for fair access to nutrition care, and managing resources responsibly. Because it's governments that provided the RUTF, we must manage it responsibly. It should not be taken home and we give it to our children in the house, because it's not purchased for those, it's purchased for those that have severe acute malnutrition. So if a child is not having severe acute malnutrition, we should not use it as lunch in the house. Professional integrity, discussing conflict of interest, maintaining competence through lifelong learning. It's not, some people is the first time they got inducted as dietitians, that is the only time they attended conference. Since that time, they have never attended any conference, they have never attended any workshop, but they are practicing. They actually not maintaining competence through lifelong learning, and they are also a risk in the profession. So adhering to regulations and ensuring professional conduct is very important. So ICDA also developed code of ethics and code of good practice for dietitians around the world, but the international standards are not meant to replace any national standards that exist, but are meant to put on paper those important matters to which we can all agree. So it's not binding, but we have something that we can all agree from ICDA, because we don't have any one that we have developed for our country. So most of the excerpt of this presentation is coming from the ICDA. So they represent a common ground for dietetics around the world. The code of ethics of ICDA is 6 in number. Number 1 is be competent, objective, and honest in our actions. This is copy and paste. I didn't change any word. And when you have it, it is like this code of ethics is that's how you present it. You don't use any other word. So dietitians must practice in just and equitable manner to improve the nutrition of the world by being competent, objective, and honest in our actions. There are a lot of things that makes us to be competent. Our education, lifelong learning, experiential learning, research, different exposures in our practice can increase our competence. Respecting all people and their needs, collaborating with other people, others, striving for positive nutrition outcome for people, doing no harm, and adhering to the standard of good practice in nutrition and dietetics. Now, the International Code of Good Practice has different sections in ICDA guideline. We have provision of service and application of knowledge. There are 5 code of good practice there. Provide high quality, cost-efficient services in nutrition and dietetics. Provide service based on the expectation and need of the community or clients. Don't recommend what a client don't need because you will make profits from it, or because an organization has asked you to be recommending our product for your clients. Even when you know that the clients don't need it, you are recommending it. That's it unethical. Competently apply the knowledge of nutrition and dietetics and integrate this knowledge with other disciplines in health and social sciences. Now, we study biochemistry, we study physiology, pathology, anatomy, immunology, all of them. But at the end of the day, is client care towards healthy diet, nutrition. We must apply that knowledge. We must know how to do it, competently apply the knowledge of nutrition and dietetics with all the other disciplines we have had our education and our exposures. Even we study communication skills, because if you don't communicate appropriately, your clients will not understand. It's not about speaking big grammar, but it's about communicating in the language that your clients understand. So work collaboratively with others to integrate nutrition and dietetics into overall care or service regardless of context. Also work in partnership with clients and users of the service. The second part of the code of good practice is developing practice and application of research. So dietitians also work in research setting, those in the university setting, those in research institutes, even those in the hospital. When we did our internship, we did some research. So it's important. So interpret, apply, and participate in or general research to enhance practice. Develop a unique body of knowledge. Have an in-depth scientific knowledge of food and human nutrition. For you to have the in-depth, it's not BS is not enough. You need to read further. You need to study. You need to subscribe to some journals that publish every month, even every week, to make sure that you are up to date with knowledge, with what is coming up from the scientific community. Now, the next one is adopting evidence-based approach to dietetics practice. Ask questions, systematically find research evidence, assess the validity, applicability, and importance of that evidence. So don't just stay and it's based on what someone else has said or what you had during internship. And it is 10 years post-internship. You have not updated your knowledge. Sometimes it's absurd when you see sometimes we send students to go to some health facilities. When they return back, they don't know how to apply nutrition care process because their preceptors have not really attended any workshop on nutrition care process. When they did internship, we have not implemented nutrition care process. And up to this time, they have not attended any workshop on nutrition care process. They have not read up to update their knowledge. They have not done anything. They just continue to tell you that they use AAA cycle. And that's what they keep using up to this time. And we are saying, no, we have moved from this. We are using a standardized language. This is the area we are now. They will tell you, I need to eat. But in developed world and in most countries, even in Africa, you need to meet a minimum number of CPD points before you can renew your license every year. So it is important that we update our knowledge every time. Combine the evidence with the dietitian's expertise and judgment and the client's or community unique values and circumstances to guide decision-making in dietetics. Number 3 is apply an evidence-based approach to all areas of dietetics practice to improve health outcomes in individual clients, communities, and populations. And number 4 is state the source of evidence. So let it not be AI. Let the source of your evidence be stated. Let it be traceable. Let it be something that if you click on this one I'm showing on the slide now, you will see the information I'm projecting to tell you that this is coming from authority, not when AI has finished hibernating, you submit it or you use it and provide guidance. No. State the source of the evidence underpinning practice recommendation and integrate knowledge of other disciplines. Reflect on how a dietitian's own perspective or biases may influence the interpretation of evidence. For instance, you don't eat pork and you meet a client that eats pork. And because maybe you have a religious attachment against pork and you begin to counsel the clients to stop eating pork, that is not ethical. So the next one is on communication. A dietitian must communicate effectively through nutrition education, and training. If you have not learned how to communicate properly, it's not a bad idea to go and get a diploma in communication or read up on how to communicate, effective communication in healthcare delivery. If you are living in a community where you need to speak Hausa language, for you to communicate properly, it's not a bad idea to go and learn Hausa language so that you can communicate properly with your clients. Development of policy as well as programs. So if you are communicating with policy organization, policy communication, the language of policy communication is an accessible language that anybody that reads it should understand it without having your professional background. So it's void of technical jargons. I also advocate for nutrition and dietetics. the alleviation of hunger, and the value of services. And in your communication advance and promote the dietetics profession. Now, the code of good practice has also in quality practice, it has systematically evaluate the quality of practice and revise practice on the basis of feedback. So you sometimes in the hospital setting, we want to get feedback from clients to know the quality of the food we give to them, to know the quality of services we provide to them. So at the end of the day, we use it, reflect on it, use it to provide training, use it to upgrade what we are doing, our current practice. Strive to improve services and practice at all times and maintain continuing competence to practice. These are all recommendations, International Code of Good Practice from ICDA. And the last one is continuing competence and professional accountability. It has 3 points. One is ensure accountability to the public. Accept responsibility for ensuring practice meets legislative requirements. Now we are having our council. Very soon it will be set up. There will be a lot of legislation that will come on. I will follow that. We must accept our responsibility for ensuring that we meet all the legislative requirements. Maintain continued competence by being responsible for lifelong learning and engaging in self-development. So the key principles of the International Code of Ethics from ICDA is number 1, professional responsibility. Dietitian must apply evidence-based care to promote health, prevent diseases, and optimize well-being for individuals, groups, and populations. Competence and continuing development. Practitioners are expected to maintain and enhance their professional knowledge and skills throughout their career. Integrity and honesty. Ethical practice requires transparency, truthfulness, and avoidance of conflict of interest. Respect for diversity. The code encourages sensitivity to cultural, social, and individual differences in dietary practices and health needs. Confidentiality and privacy. Protecting client information is a fundamental ethical obligation. And accountability. Dietitians are responsible for their professional actions and decisions, ensuring they meet both ethical and legal standards. So, the core responsibilities of the dietitian is you have to maintain up-to-date knowledge, be confidential with safeguarding client information. There must be cultural humility, recognizing and respecting diverse values, traditions, and ways of knowing to provide culturally safe and inclusive care. Integrity and honesty, evidence-based practice, transparency, and maintaining professional boundaries, maintaining appropriate relationship. A dietitian don't go into sexual relationship with clients because you are in the position of power. If in this part of the world, it must be 1 year post the last scene before you can go into any form of relationship or you get married to your former clients. There must be that separation. Boundaries must be set. And you must act in a professional manner as outlined in the Code of Ethics. So ethical decision making. How do you make ethical decisions? So ethical decision making in dietetics requires balancing competence, integrity, and welfare, rooted in 4 principles: autonomy, beneficence, non-maleficence, and justice. So professionals must maintain competence, disclose conflict of interest, and provide evidence-based care. There are 6 points in a framework that have been identified in various literatures to help in ethical decision making. Number 1 is you need to identify the problem. Determine if the real issues, is it an ethical issue, is it a legal issue, or a professional issue? You need to clearly state the ethical conflicts, which often involves competing interests or values. Then the next point is that you need to gather all relevant information. Consider personal values, the client's culture, legal requirements, and professional standards. And then you need to consider ethical principles. Determine which of the 4 principles that are in conflict. The principle of autonomy, beneficence, non-maleficence, and justice, which of them are conflicted. And then explore options. Assess potential causes of action. What will you do based on their consequences and alignment with the code of ethics? And then consider, I gave you a sample of code of ethics of Academy of Nutrition and Dietetics of America. I shared it. It's part of what I sent to you. So you could look at it and see their various code of ethics, apart from the ICDA one I shared with you. So consider context and make a decision. Evaluate the patient's decision, situation, and cultural context and legal ramification. Then implement and evaluate your outcomes. So take action and assess the consequences. This an excerpt from the American Academy of Nutrition and Dietetics, that of America, on also framework for ethical decision making, which also say the same thing. State an ethical dilemma, connect ethical theory to the dilemma in practice, which is the principles of ethics, autonomy, non-maleficence, beneficence, and justice. Apply the academy, which is their ethics academy code of ethics, to reissue. So this might not be applicable to you, but it will be applicable if you want to pick up that of ICDA, or as soon as Dan develops one, which we are going to adopt in Nigeria. Then select the best alternative and justify your decision. And develop strategies to successfully implement the chosen decision, and then evaluate the outcomes and how to prevent a similar occurrence from occurring again. So these are very important steps in ethical decision making. So you must always check whether you are conflicted. What type of thing is this? Is it ethical? Is it political? Is it professional issue? Or is it educational issue? So ethical challenges in dietetics practice, there could be many challenges. Number one is cultural conflict. Difference between professional recommendation and client belief, food tradition, religious dietary laws, and hate perception, the risk of imposing Western dietary standards. Don't belittle what other people are eating. And so because you are not eating this, you are not, sometimes we take it to be a sign of affluence, but it's not. Then the next is misinformation. Today, social media and digital platforms are washed with misinformation. Dietitians often face ethical dilemmas when clients strongly believe in misinformation, such as fat diet, detox diet. The challenge lies in correcting misinformation without dismissing the client's perspective and maintaining trust while upholding scientific integrity and non-maleficence. So pressure from client requesting unsafe or ineffective diets, or what will not even be sustainable. Conflict of interest. We see this occur mostly in industrial basis, food supplements, pharmaceutical companies, bias in recommendation due to sponsorship or funding. They promise to sponsor you to attend this year's DAN conference in July. And then you say, okay, because of that, I'm going to go and make presentation based on something that has not been verified, has not gone through peer review, has not gone through proper testing, and you want to endorse it on social media, you endorse it on your platform because you're a trending dietitian, and then anything you post it. You know that people trust you. There are people that believe in whatever you say that is correct. So there are ethical concerns in product endorsements. So accepting funding from food companies who create bias in recommendation. And ethical practice requires transparency. If you must accept it, you must disclose it. So, and then prioritize the client's best interest over commercial gain to maintain professional integrity and public trust. Time and resource constraints, limited consultation time, high patient load, and inequitable access to nutrition care. This is common when you have one dietitian serving the entire hospital. So the workload is so much, we can affect quality of and depth of care we provide. So ethical tension arises when practitioner cannot fully meet client needs due to time pressure or system limitations. This raises issue of justice and equity, as well as raises issues of particularly for populations that receive less comprehensive care than others, especially poor people. Then working with vulnerable populations, people at risk, low-income groups, immigrants and refugees, children, women, older adults, power imbalances and risk of exploitation, and then barriers such as language, literature, and access. So these vulnerable populations, ethical care requires sensitivity to social determinants of health, including food insecurity and systemic inequities. Dietitians must avoid blaming individuals of circumstances beyond their control and instead advocate for equitable and supportive interventions. And then reflective practice. Reflective practice is one of the first steps we use in addressing ethical dilemmas in dietetic practice. So this is what you will in every dilemma. You must first of all want to reflect what self-evaluation of decisions you are taking, your biases, and your critical reflection on ethical challenges are what you encounter in practice daily. And use of reflective tools like you write, journaling, you want someone to observe you, supervision, you report to your supervisor, you talk to someone else to help you take a decision or a case review is very important. Another step in addressing ethical dilemma is interprofessional collaboration, working with healthcare teams, physicians, nurses, social workers, and psychologists. Sometimes it could be things that involve sexual harassment. You might want to invite another person to take over that case. So sharing diverse perspectives to inform ethical decisions, as well as enhancing holistic and patient-centered care. Another point is consulting with ethics committee or senior colleagues. Seeking guidance in complex or high-stakes situations is very important in addressing ethical dilemmas. Institutional ethics committee provides structural decision-making support. This ethics committee could be your supervisor, could be already established board that you need to report to. You want to conduct a research. You don't just move on to do the research without ethics. Also, use of policies, guidelines, and case precedents. What has happened before? Was it handled and all that can help you also take a decision. Then continue professional development. That is one important area you must always adopt to avoid ethical dilemmas, handle ethical dilemmas. Ongoing education in ethics, cultural competence, and emerging issues. Staying updated with professional code of ethics, evidence-based nutrition guidelines, technological and societal changes, and participation in workshops, in seminars, and certifications. Now we have had some time to talk about this. We are going to do some group work, but before we go into the group work, let's do an individual work. You are going to type the answer to this question I'm going to be posting now on the chat. Just 2 questions. The first one is here. You are the only dietitian in a government hospital in Abuja. A patient in the ICU requires parenteral nutrition urgently, but you have never managed such a case before. The physician tells you, just do something, we cannot wait. What do you do? Have options there. Quickly design a plan using Google or an AI and proceed. Refuse completely and walk away from the case. Inform the team of your limitation and provide basic self-support and urgently seek expert guidance. Example, remote consultation. Copy a previous ICU nutrition plan and adjust it. I'm looking forward to seeing your responses on the chat. Okay, almost everyone is saying C. I've not seen, everyone is saying C. I've not seen any other one. Okay. Good job. Thank you, everyone. Yeah, the answer is correct. So we see here that the correct answer is C. The option reflects ethical and professional best practice. The dietitian acknowledges limitation. This is professional competence. Avoids harm and still supports patient care by seeking expert input. Now, if you use AI or you do another stuff, option A and D, which is copy a previous ICU or AI, you risk patient's harm due to inadequate expertise because you don't even know when it is correct or not correct. So if you are using AI, you still need to have a knowledge that of what is correct and what is not correct because AI hibernates. Or if you walk away completely, you are withdrawing or you are abandoning the patient. This violates beneficence, doing good. So you are providing safe care within limits while seeking support. So question number 2, you are a part of a nutrition study in a rural community in northern Nigeria. Participants sign consent form, but many cannot read English. Nod without asking questions. A community leader says, they trust you, don't worry. What should you do? Continue because consent forms are signed. Stop recruitment and redesign the consent form using local language and verbal explanations. Ignore it. It is common practice. Ask the community leader to explain on your behalf. I'm looking forward to seeing your answers. Okay, I'm seeing a lot of people are saying B. I'm seeing one person said D. Yeah, B and D. B, I'm seeing a lot of B and D. Okay. D, B and D. Okay. Okay. Thank you. So the answer to that question, because I'm having a lot of, some people are confused. They are giving me two answers at the same time. The answer to that question is B. Informed consent requires understanding, voluntariness, and adequate information, not just a signature. Using local language and cultural appropriate communication ensures true autonomy. A and C ignores ethical violation, while D risk information, misinformation. The reason is because look at in the question, the community leader already say they trust you. Don't worry. If you ask him to go ahead and explain, you will not know what he's explaining. But if you go back, redesign, put that in a local language in a way that the ethics committee that will review it, understand the language, they will be able to know, so, okay, this is appropriate for this level of learning. So it's very important, respect for autonomy and justice. That is the ethical principle. So now we want to go into a breakout room. In this place, we are how many? We are 99. So we'll have 10 breakout rooms. And we're going to be discussing questions. So before we go to the breakout rooms, I want to share the questions. Okay, you can go to the breakout room. I will share the question as a broadcast. Just choose a breakout room. Sorry, I'm trying to close the breakout room. Let's look at the question before we go. I can't show the slide in the breakout rooms. It's the only message I can type there, and I have it on slides. So I'm closing the breakout rooms. Those that have not gone, just stay there. Those that have gone, I'm bringing them back. Okay, good. We are all back. So the question on breakout rooms, the first question will be this. Your room can choose the one they want to answer. So the first question will be this: industrial partnership and professional integrity. You are a senior dietitian in Lagos involved in a hospital-based diabetes program. A multinational nutrition company funding your program invites you to feature in a social media journal describing their supplement as supporting improved glycemic control in patients with diabetes. Participate in a webinar as a clinical expert. Receive fully funded international conference sponsorship. You are aware that preliminary trial results show modest benefits, but findings are not yet peer-reviewed. Some patients in your clinic experience side effects. The company will target low-income populations who trust healthcare professionals. Your hospital encourages a partnership for future funding opportunities. What is the most ethical, appropriate course of action? Option 1 is accept the offer and participate, ensuring your statements are cautiously worded and not misleading. Participate in the campaign, but include a verbal disclaimer that results are still under evaluation. Decline participation in promotional activities and advocate for evidence, transparency, and separation between clinical care and marketing. Accept the sponsorship, but avoid direct product endorsements, limiting your role to general nutrition education. This is the first question we're going to discuss. And the second one, when we return, we are going to discuss the second one. So let's go to our rooms and discuss this first one first. Now, we'll go back to our breakout rooms, please.
How do I get back to my data room?
So yeah, all welcome back.
Okay, thank you, sir.
Yeah, so who wants to go first? Which room wants to go first? What is your answer? Tell us what you discussed. Why?
The main room.
Room 1. Room 2, anyone can go first. Which room is going first? I should call names. Amuche.
That's not like. There
Which
was a
room were you?
room 9. It's not yet our turn.
No, we are not doing it by number. Just it's not sequential. Anybody can start.
I had a concern because I was thinking this slide would have been shared, you know, on different rooms. So we had a hard time trying to figure out what the question was.
I shared the question on the chat.
On the chat?
Yes.
I didn't know.
Okay, Joseph Samuel. Go ahead. Tell us what you discussed in your room.
Okay, room 2, Joseph Samuel. So majority of us picked option C. Hello, sir. Can you hear me?
Yes, we can hear you.
Okay. Majority of us pick option C, and this is looking at the ethical issue here. There's a weak scientific evidence. So as a dietitian, you have to consider a lot of things, because even if you disclaim anything, your patient might actually, or now looking at the population listening to you, they might not actually get the verbal part of it because of the influence that you carry. So you have to decline participation until robust peer review evidence is available. Also, you have to advocate for patient safety and informed consent. Transparency is also important because of the risk and the uncertainty. We have to avoid involvement in initiative driven by financial conflicts rather than patient benefits.
Thank you very much. Thank you, room 2. So those in room 1, do you want to come now? Do you want to comment? Whichever room that wants to. Okay, thank you.
In group 1, actually, we didn't have a consensus agreement because we're still trying to figure out as a team, as a group. But however, we had some personal or some person making their opinion or making some choices based on the available options. I chose 2 options from here. I said I will participate in the campaign, but I will make a disclaimer, because if I don't inform the people, that's where the confidence comes in as a professional healthcare, as a healthcare professional, because my clients believe in me. If I don't inform them properly that this has not been peer reviewed, and also, remind the company to go and peer review this product, my patient or my client might still go ahead, or another person might also misinform them. So I will participate. I will let them know that this is still the process, or this product has not been peer reviewed, but this is my position. So I will make a disclaimer as well. This is where we are. So we didn't come as we didn't get a conclusion as a team. Thank you.
Thank you. Which other room want to go?
Okay, good evening, sir.
Good evening.
Okay, my name is Rose Valin. I would like to speak for breakout section 10. Though we were still choosing our options, some went for C, some went for Z, but I'll just hang it on the two options. I will explain for C. I'm going to go by my personal choice now for the group, though I know it's not the general group's decision. The thing is, for C, you have to decline. For me, I'm using my science with the art of media. I'm going to decline participating in promoting the activities of the company and seek for evidence-based transparency, which I know that the company may not be able to give, because most companies they have seen, oh, they've had you're a dietitian and they know what they stand to gain with that particular license of yours. And when you seek to go for either monitoring of their environment, you want to investigate what they are doing, you see that they want to limit you and they wouldn't want you to go further. That is especially here in Nigeria. So in other words, because you know that they know what you want to do, they know what you're about to come for, and they know that what they are doing is endangering the health of the patients. Now they're coming to you with sweet tongues and all of that to advertise their product. Now you've declined that. And by telling them this other aspect of it, they will now understand that you want to teach them the impact of what they are doing to the health, which they don't want to hear. And you want to separate that aspect, tell them the importance of that into clinical care of those people, because you're not going to market anything for them. I'm not going to be marketing their supplements. I'm not going to be marketing whatever they have, but show me what you're producing. Show me what you're doing. Let me go to that. Let me know if what you're adding, like if you're talking about supplementation and all, if it is true, which of course we know we don't do here in Nigeria. So that is where we are. For the D, I think I will please, can I request the other partner of mine to say for D, or should we leave it for that?
Okay.
Sir?
Yeah, if the person is willing to speak, that's okay.
Yes, sir. Dietitian Henry, please speak for D, sir. Thank you.
Okay, good evening, everyone. Meanwhile, I picked C, so C has been my option, just as you explained. So I didn't pick for D. Maybe anyone that picked for D can talk about it. Thank you.
Okay, thank you very much. We need to move to the next question, but before we move, let me provide my perspective and evidence-based perspective on that. If you ask me, if you ask most dietitians over here, the answer is C. The reason is because it fully protects professional integrity, avoiding conflict of interest. Somebody is sponsoring you and giving you something, okay, come and speak, you go for this. Also, preventing harm from premature promotion. It's not yet ready for the promotion to happen. Also, justice, protecting vulnerable population from potential exploitation. These people trust you. Vulnerable group, they trust you as a health professional. So whatever you say makes a lot of impact in their life. And also public trust in the dietetics profession. It's not something that dietitian will say one thing today, maybe tomorrow. The new findings from that study will show that it is even causing harm to the kidney. Modest benefits for some group of patients, group of clients, but causing harm to the kidney at long run and other stuff. So even subtle or carefully worded endorsement can influence patient behavior, especially in context of the healthcare professional. So if you look at A is a cautiously worded. That could be misleading because it still constitutes implicit endorsement. Patient may interpret this as clinical approval, but does not eliminate conflict of interest as well. Adding disclaimer are also ineffective in real-world communication. Power imbalance means patient may ignore uncertainty and still promotes an unverified product. And then D, indirect involvement. You accept the sponsorship, but avoid product endorsement, limiting your role to. So indirectly, you are still involving yourself, even without explicit endorsement. Association with the company creates perceived credibility in this. So we want to go back to breakout room for this question. I'm going to post this question to the chats. I'll post it to the chat, but let's look at it first. Let's read it. Yeah, you are not required to go back to the previous breakout room. We can join another breakout room, whichever one you prefer.
Excuse me, Dr.
Yeah.
Naloy.
Yes.
Okay. Sorry, please. Greetings from over here. I want to also add something. You know, we are talking about influence. It also has to do with influence. Now, you're from an organization, the hospital. Sorry, this is Dashanikara.
I know.
Then, you also talk about your management, the influence of the management in this thing. So this is what it's supposed to be. At that point that you are being influenced by your management, because this is practical aspect of it, what will you do?
Your hospital encourages partnership for future funding opportunities. Remember that the management also is a professional, but they don't want to participate. They are forcing you to participate. Read the ethics of your profession to your management.
Yes,
right?
I understand so well.
For ethical standard, your management would not want you to behave unethically. They might not even know. So you have to provide that education to them, to educate them on this, because that's why you cannot do this. Sometimes you assume that they should know. No, don't assume. When I was preparing for this, I didn't assume that people that will attend know the definition of a dietitian. But I know I was going to talk to that group of dietitians, but I also assumed that some will know it. Still, I brought the definition of dietitians. So you are talking to your management, they are health professionals. Don't assume that they know what you as a dietitian will do, because you are the one that is a professional, and it is in your own professional purview to provide the adequate, proper information to your management. When they understand, you see, there are some things that when we have an established life, established protocol, established ethics, people won't even ask us whether we want to do this thing. They know what we will do before they ask us that question. So sometimes they are asking us to fulfill our righteousness. And if we go ahead and do something that is wrong, they will be surprised that this person has changed. What happened to him or her?
Yes.
So
thank you so very much. Then, in the other hand, if one person declines and another person picks it up, does the association has anything to do as in such a situation? Because
this
the person that
is where I was saying we have not established our code of ethics. And one of the things association does is promoting the well-being of their members and their professional development. But when the council start operating, now we have the council signed, the bill is signed. So, I mean, the bill has passed. When the council start operating, they can implement discipline to its members when they err on the side of ethics. If you check most developed countries, if a dietitian is disciplined, it's put on their website, on public, the name of the dietitian, what the dietitian did, and whatever that happened. I want us to finish the next session, then we'll have time for discussion and questions and answers. Well, if we check in that, we might not go to the next breakout room. So let's do the next question. Is that okay? Thank you. So question number 4, you are a clinical supervisor in a teaching hospital in Nigeria. A newly recruited dietitian holds a recognized degree but demonstrate serious gaps in practice. Unable to apply nutrition care process effectively. Struggle to justify intervention using evidence-based reasoning. First, to monitor and evaluate patient outcomes. Avoids complex cases and lacks confidence in clinical decision-making. You later learn that their training program was focused mainly on theoretical knowledge, had limited supervised practice exposure, did not include robust competency-based assessments. Despite this concern, hospital management insists they are qualified. Let them continue practicing independently. We need staff. Now, there's a document I gave to you. The ICDA standard, competency standard. You are going to make use of it. So using ICDA International Competency Standard for Dietitians, Nutritionists, 2016, you will see it in the email that was sent to you. At least 2 competency or section from the ICDA standard to justify your answer. There, select the most appropriate action that you will take. Allow the dietitian to continue independent practice since they meet minimum academic qualification. Provide informal mentoring while allowing independent practice to continue. Restrict independent practice. Implement structural supervision and assess competence using competency-based standards. Remove the dietitian from all clinical duties permanently. So we are going to move to our breakout room now. I'm going to paste this same question in the room. In the charts. I'll paste it in the charts. Yes.
Stop now.
Remember, Miji, please go ahead. Put people in breakout rooms. Please kindly join a breakout room, discuss this question. You will listen to you at the end. Don't stay in the main room. I'm still seeing a lot of people in the main room, up to 48. Join a breakout room, please.
Please, how do I join a breakout room, sir?
Let me see what I will just assign. Ozioma, right?
Yes, sir. Oh, thank you.
Please, how do I join the breakout room, sir?
Israel. think everyone here is assigned to a particular breakout room. If you have not been assigned, let me know. I'll assign you. Okay. I've assigned everyone to a breakout room, so I'm not expecting anybody in the main room. I'm seeing Oledo, I'm seeing Akachuku, I'm seeing Ngozi Adevi. I'm still seeing a lot of people in the breakout, in the main room. You are supposed to be in the breakout room and not here. So waiting for everyone to return from the breakout room. Then we listen to your discussions in the breakout rooms. Okay, we have enough questions in back. We have 89. I think we're 100. So while others, the breakout room should close automatically. Who wants to go first? Which room wants to go first?
Room 1.
Okay, please go ahead.
So our choice was answer C, to restrict independent practice, implement structured supervision, and assess competence using competency-based standard. So by restricting independent practice, we are ensuring that there is no harm done to the patient by the newly recruited dietitian. Then implement structured supervision. I think this is one of the, if you look at some of the, will I say, the guidelines or job description of a dietitian, part of it is also supervised training for younger colleagues. And again, assess competency using competency-based standard. I think this will help us to do like clinical auditing or reflective practice for the newly recruited dietitian so that we can evaluate whether he or she is improving with time. And again, why we also chose that answer is because when we restrict independent practice, there are other bits of activities within the dietetic office the person can do. The person can review ONS or do anthropometric assessment, which may not have direct harm on the patient, while we gradually build the dietitian's confidence with time, while the person is having the supervised training. So that's why we chose that answer C. Thank you.
Thank you very much. That's a comprehensive answer. Any other room wants to go for?
Yes,
Which
room
other
5.
room wants-
Yes, room 9 would like to speak to.
Okay, Alozie, please go ahead.
Okay, in our group, we unanimously agreed to go for C, which is the same thing that the last speaker just said now. Restrict independent practice, implement structured supervision, and assess competency using competencies-based standard. We drew our inference from the documents you shared earlier. From 2.0, 2.0 has to do with evidence-based practice and approach of research. And then we also made our inference from 5.0. 5.0 has to do with knowledge essential for the practice of dietetics. So if you look at the document, you know that it's quite voluminous, but this is where we made our conclusion from. So we go for C.
Thank you. Any other who want to share before we conclude for today, and then have final discussions?
Yes, room 5.
Yeah, room 5, please go ahead.
Room 4.
Okay. Okay.
In room 5.
Let's have 5. Yeah.
Room 5, we actually choose option C too. But somebody actually said it all depends on the institution, which practically I say yes. There are some people that have very fewer dietitians in their institution. I'm bringing down to practical aspect, but that's the right thing to do. That's the C. And then there's also an institution that somebody will go, you are the only person. You are the only person there. So in such cases, which is always occurring, please, how can we help? What could be done, or what should the person do? Then there is another.
In this case study, we are not having different scenarios. The question should be based on, the answer should be based on the question provided.
Okay,
we talked about limited, we talked about having a clinical dietitian that is a supervisor. We are talking about having new recruits. So let your answer focus on the case study presented.
It's actually C.
And
while
Thank you so much.
Independent practice, the supervisor should also look at the competence so that to post the person where the person is.
Room 6. Group 4.
Thank you. I will go for room 2. Room 2 mentioned first. Let's hear from room 2. Room 2.
Okay, good evening once again. From room 2, we take our inference from safety assurance. So we are going for option C, and that's actually talk about the quality in practice, that there should be a systematic evaluating the quality of practice and revision. So, and if the dietitian cannot actually interpret or make appropriate intervention, that person needs to work with a senior that's going to help to evaluate why it's going to grow. Another domain where we take our influence from is about the leadership. So which talk about this, why supervisor have a great work to do, in which you have to strictly work with the dietitian, while the dietitian also be willing to grow.
Thank you. Room 4. If room 4 is not available, room 6. Those are the two rooms that are remaining. Yeah, room 6, please go.
Yeah, room 10. 6, option C. And we also suggested a rotational posting for the dietitian by the supervisor.
Thank you. Okay, room 4 now.
Room 10.
We went for option C.
Okay.
Can you hear me?
Yes. What's your reason from the documents shared with you? I can't hear you again if you are speaking. Okay, let's hear Munachi, room 10 lastly. Okay, I can hear you now. And then maybe you type, your network is disturbing. Munachi, please go ahead.
Okay, for room 10, we all agreed on option C, and the reason is almost similar with what other groups have said. As a new recruit and from the guideline, is not allowed to practice independent. So give close monitoring and close supervision, and based on the, what is it called, competency-based standard. So we all agreed on option C.
Okay, thank you. So with that, we want to go to conclude, then we take questions. So in conclusion, ethical decision making is central to safe, responsible, and professional dietetics practice. Competence must be demonstrated in practice, not assumed from qualification or from the name of the university an individual has attended. Dietitian must consistently apply ethical principles, professional standard, and competence framework. I have shared this with everyone that registered for this webinar. Also, real-world practice involves navigating complex clinical situations, resource constraints and systemic challenges, cultural and social determinants of health. So ethical dietetic practice requires integrity, accountability, and continuous competence to ensure safe, equitable, and evidence-based nutrition care. So in the final reflection, one thing is that ethical dilemmas are not problem to avoid because it will always happen, but it's an opportunity to reflect, improve our practice, and strengthen professional responsibility. As a dietitian, our responsibility goes beyond giving advice. We're entrusted with people's health. So ethical practice ensures that this trust is never compromised. A qualification may open the door to practice, but it is competence, integrity, and ethical judgment that sustains safe and professional care. Ethics is not what we know. It is what we choose to do when it matters most. Thank you. I'll hand over to the General Secretary.
Thank you very much, Dr. Lloyd. That was quite enlightening and impactful, and it has opened our eyes to a lot of things. So without wasting much of our time, please, this is time for questions. And we're already far gone with time. So I would like us to please be conscious of the questions we want to ask. And if somebody has asked the question you want to ask, there's no point asking it. And then please streamline your question and make it as simple as possible. Don't ask 4 questions in one so that other people can get an opportunity or have an opportunity to ask their question. So this is almost 10 p.m. So we're probably just going to allow a maximum of 5 questions. Please, if you want to ask a question, please raise up your hand. Do not unmute your mic to just ask question randomly. You must be called upon to ask your question. Please raise your hands now so we start. Thank you. Raise your hand if you have any question. Ozioma, Dietitian Ozioma Okoro, please ask your question. You have 1 minute, please. Dietitian Ozioma, please ask your question.
Sorry, I don't have any question. I just appreciated you. Just gave a thumbs up. And not a question.
Right.
Thank you.
All right. Yes, any question?
Yes, I have a question or
Please,
a
you're entitled to
clarification.
one. You're entitled to 1 question, please. Go ahead.
Yes, thank you, Dietitian Aloy, for this wonderful presentation, and to our dear organizers. Thank you, Daniel Schools. Please, my question is on maintaining professional boundaries. Like there is an interface between diet and exercise. A colleague shared with me how he just gave a tip on how a patient could exercise, whereas the woman had a heart problem, and that nearly cost him his job. You know, as dietitians, we talk about little exercise, maybe for obese patient or for diabetic patient to maintain a normal blood sugar. How do we strike balance between such a situation? Thank you.
Professional
Thank
Lloyd,
you.
do you want to answer it?
Thank you for
Or
your question. I want to get more questions, then we'll take
all
it at
right.
the same time.
Okay,
Okay.
fine. Please lower your hand, and Wachuku. Any more questions?
Alozier's hand is up.
Okay, Alozie.
Okay, thank you, Dr. Loy, for the presentation. It's quite a very incisive one. A lot of things to unpack. And organizers, I really appreciate your time to give us these invaluable contributions, learning material. Okay, I just want to ask, please, what are the legal implications of this last scenario that you created? Because I believe it should have some legal implication. That's all I want to know, both to the supervisor and to the hospital.
Thank you. Any other question? I can't see any other hand up. So if I answer, that means we are closing for the day. Okay. So the first one in terms of okay, let me start from the last scenario. The last scenario that was created in terms of that we have the bill that have been signed, that have passed through now. I think it's yet to be signed into law. But once it's signed into law, it's enforced. And one of the things that happens is that it becomes a legal document that you can use to sue or be sued for against. And if a dietitian is incompetent, depending on the jurisdiction, in some countries, it's not even just the hospital that you will report to. You will also have to report to the regulatory body that this person is incompetent. In fact, where I live, you will report to the regulatory body. The investigation will have to come from the regulatory body. So these are things we are still growing, and I know that we'll get there. Like someone who has not been properly trained, who has not gone through internship, who did not study nutrition and dietetics, who has nothing to do in the hospital, and is practicing as a dietitian in Nigeria. And he even has certificates. Anybody can report that person. And the person can be reported both by the hospital or even a client can report the person, and that person can be investigated. But mostly the investigation goes through, you have to write. It's not just by hearsay, because they had to follow through whatever they have said. So in other aspect of legal implication, I'm not a lawyer. I'm a dietitian. So I stop and maintain my professional boundary. Just like I want to answer question on professional boundary. So the question on professional boundary, there are some, in our counseling sessions, there are some things we say that are general information that every other health professional can ask a client who is obese, who has diabetes without complications, to be physically active, take a walk, just like that. But when it goes into an extra level of exercise that needs a physiotherapist or physical therapist to provide, the dietitian can't go to that length because of your level of professional competence. You might actually be a physical trainer, but you are not certified. In this part of the world, if you are not certified and you have been doing some things in the gym and you ask someone who has had problem to do the same thing and the person has issues, you will not be safe. Your license will not be safe. So it is important we know our limit of competence and practice within the limit of our competence. That is why you have the other allied health professions, which you can refer your client to. That after this, go and see the physiotherapist. The physiotherapist will provide that particular counseling. So maintaining professional boundary, not just even in area of exercise. For instance, you don't know how to formulate interior diet, and you have a client, you start doing it, providing it when it is not within your competence. You have not developed that competence. You are acting beyond your professional capacity, beyond your boundary. So you must maintain that within what your competence, what you can do, what you know you have been trained to do. That's what you are supposed to do. Remember, I asked a question during the presentation. You have a client, hospital say we don't have time, go ahead with parenteral nutrition. You rush and go to Google, or you use AI to do it. It's wrong. Even though you have knowledge of nutrition, if you know you have not been trained to do that, don't do it. Thank you.
Thank
General
you so much,
Secretary, over
yeah,
to you.
thank you so much. Yeah, thank you so much, Dr. Aloy. I want to believe that we have all enjoyed this webinar. And like I said, many regards to the education committee, and this is actually coming in the nick of time. We hopefully that we can keep doing this over and over again to remind us. And then even though we don't have a regulatory body yet, we need to do the needful. I want to also remind us that a lot of things happening in our society now, and a lot of legal implications are involved. So don't say because you're a dietitian. You know what happened recently with the Chimamanda case. Chimamanda case, and a lot of the doctors have been suspended already. So we need to be very careful with what you say to your patients, with what you do. Ensure they are within your scope. They are within your professional boundary. They are within your professional line. So I just want to add something to the exercise thing. General exercise will tell you just do brisk walking at least 30 minutes per day or at least 4 times a week. I mean, that is general enough. And then if you feel your patients need more, please refer to the physiotherapist. We must know when to refer patients. We complain that doctors don't refer to us. They just talk to a patient. Then we shouldn't be found doing the same thing. I also want to use this opportunity to say a lot of things which will actually guide us in our practice here in Nigeria while we wait to adapt our own ethical code of conduct here. First and foremost, like the question that was asked, let me bring it down to our society. If you have a new staff, on no account should that new staff work alone before confirmation. And so that's like 2 years. The person is on probation until confirmation, and that takes 2 years. So that new staff is supposed to be fully supervised before their confirmation, before you can leave the person to a patient. And then confirmation also does not actually, excuse me, does not actually mean that, oh, you are now free to manage patients. You will be, the person will be assessed too. If the person is assessed and the competence can be verified, then the person will be allowed to, maybe be given a ward or attend to patients independently. But if you are assessed and if your supervisor feels that you're not good enough, you will still be under supervision. We need to know that and do the needful. And then again, one of the things we have taken from this presentation is being honest. Being honest with what you can do, being honest with what you know when to say no, know when to draw the line, and know when, no matter what. I'm the national secretary, and I can confidently tell you the amount of complaints I get for the association on members. A lot of us have been involved in promoting products, all because of we're probably going to make some gain or have some things to gain monetary gain from the product we're endorsing. So we don't care whether our patients have to go through a lot, pay through their nose to get that. So why would you, if you can recommend an adequate diet and encourage your patient to eat well, why recommend supplements that will cost an arm and a leg when the patients can actually get that from their diet? We really need to review what we're doing. We really need to look at ourselves and know that, oh, these things are not fair, these things are not honest, And we need to go beyond our personal gain and look at our professional legacy and look at what we need to protect. We need to know our boundaries. Another thing I like to talk about is fraudulent acts. A lot of us, one of the reasons, I think I will say it here, one of the reasons the executive insisted on people having, of we collecting hard copies is because over the years, we have also noticed fraudulent acts. Because I remember like about 3-4 years ago, we started giving virtual certificates. I know a lot of requests, a lot of things that have been submitted to the association, to my table, based on fraud and how people now edit these certificates for their use. We still have a lot of queries from HCPC. A lot of issues will still unfold. And it breaks my heart that all of these are coming from the fraudulent acts of our members. And it breaks my heart that DAN members are not being honest. So we have a lot of issues on ground. A lot of things will still unfold from HCPC. We're getting a lot of reports. And then I want to categorically say it here. DAN is not going to endorse or embrace any form of dishonesty or any form of fraud. We're going to make a disclaimer, and then the person will be on their own. It is so very sad. We're getting a lot. You should know your boundaries. You should know what you can do. You should know how far you can go. If you're not qualified for something, I mean, reach out to your superior. That is why we have superiors and supervisors. But our young people don't reach out to their superiors. They do these things, and when the problem comes, their superiors will be called. Another thing that have come to our table that we're beginning to see now is a lot of older dietitians have practically stopped working. They have stopped working in their various centers. An education committee will be coming up with a lot of stringent measures. If you know, somebody posted on the platform today, and I thought it was very beautiful. If you know you are done, you don't want to work, quietly resign. And don't stop telling us, I have done my part. This is what we've done during our time. If you know you are done, quietly resign. You are there as a senior to supervise and not to just begin to send. We also have issues from interns where interns have been turned to messengers. We were not going to tolerate all of that. Those are unethical